Okay, welcome back. I am Dr. Kaleem Raza. So today we are going to discuss something about the anterior abdominal wall. As we know that that in abdominal cavity we have got all important organs of GIT, but there is only one protection anterior side, and that is the strong layer of the muscles, and above muscles we have got layer of the fats, the facial layer. But in chest we have got respiratory organs, we have got roots of the great blood vessels, we have got heart, and we have got different types of the mediastinum, and this part is preserved in rib cage. Lower part is the pelvic organs are basically preserved in pelvic girdle, but this part is entirely saved in this abdominal wall. So we have got anterior abdominal wall, we have got lateral abdominal wall, we have got posterior abdominal wall also. So this is very important to understand the anatomical layers of all the muscles, the fats, the tissues which are enclosing these abdominal organs. So we will discuss one by one, layer by layer. So first, suppose you are approaching to any peritoneal organ. First you have to remove the skin. So first layer, remember, first is the skin, and after skin you have got facial layer. So facial, so this is anterior abdominal wall, and anteriorly you have got rectus abdominis muscle. So let me draw, so you should have better understanding. So anteriorly, most anterior, so this is linea alba. Here we have got inguinal ligament. This is inguinal ligament, and anteriorly we have got rectus abdominis muscle. So the six pack muscle. So this is the rectus abdominis muscle anteriorly. And first layer I have told you that will be your skin. So layer by layer we will discuss. First is skin, then we have got layer of the fascias, the fatty layer. We have got superficial layer of the fascia, and we have got deep layer of fascia. So skin, superficial fascia, the Kemper fascia, and deep fascia, the Scarpa fascia. And anteriorly, you can see this is anterior side. Anteriorly we have got rectus abdominis muscle, and on the lateral side we have got three layers of the muscle. Later I will show you the structure also. So first layer on the lateral side we have got this external oblique muscle, and this is external oblique, and then behind the external oblique we have got internal oblique, and then we have got transversus abdominis muscle. Transversus abdominis muscle, and here we have got serratus group muscle, the serratus anterior muscles. So here we have got serratus anterior muscle. At the lower end, here we have got another muscle that is called as pyramidalis muscle. So remember, at the lower end we have got pyramidalis muscle, and here we have got the Hazelback triangle also. So now we will move back to that structure. Okay. So here you can see that first layer is the skin. After the skin we have got Kemper's fascia, the superficial layer, fatty layer. Then we have got Scarpa fascia, and then we have got external oblique muscle, we have got internal oblique, and this transversus abdominis muscle. And behind the transversus abdominis muscle we have got transversalis fascia, and behind the transversalis fascia we have got extraperitoneal fascia, and we have got parietal peritoneum, and inside the peritoneum we have got abdominal organs. Few organs are under the peritoneum, the intraperitoneal organs. Some organs are behind the peritoneum, those are called as retroperitoneal organs. So you have to understand that two important layers in these all layers, especially the aponeurosis, this part of the external oblique, or transversalis fascia, which is a deep layer. These are two clinically very significant layer. So here in this structure, later I will discuss about the transversalis fascia layer and the aponeurosis of the external oblique, but first focus on this structure. Here you can see the anteriorly, this is the rectus abdominis muscle, and then here you can see this one is the external oblique. So fibers of the external oblique are basically running downward. Here you can see running downward, and here they are basically inserting on the linea alba also, and this whitest part is called as aponeurosis. So this is called as aponeurosis. It's similar to the tendons, that wherever muscle are inserting on the bones, that is called as tendon. So this whitest sheet is inserting on this medial structure, the linea alba. So this is also called as aponeurosis. So aponeurosis of the external oblique, this is clinically significant, because at this part you have got superficial inguinal ring, and any hernia that will come from this part, here you have got one triangle that is called as Hazelback triangle, and this medial boundary of Hazelback triangle is found by lateral border of the rectus abdominis muscle. Laterally you have got inferior epigastric artery, and lower side you have got basically inguinal ligament. So what is the important thing that I want to highlight here, that any hernia that is coming directly from this Hazelback triangle or directly through the aponeurosis of external oblique muscle, this is basically direct hernia. This hernia is common in adult males in older age, but other layer I have told you, the transversalis fascia layer, that is basically deep layer, and that is basically opening of the inguinal canal, and a hernia coming from that deep inguinal ring, that will be lateral to epigastric artery, and that type of hernia is called as indirect hernia. So indirect hernia, it's common in children. So this is one of the most common hernia or most common inguinoscrotal swelling. So you have to understand two layers, especially the aponeurosis of the external oblique and then transversalis fascia. So here you can see the fibers of the external oblique, they are moving downward, and they are coming onto the linea alba also. But this second muscle behind the external oblique, this is internal oblique. Here you can see the fibers of the internal oblique, and then transverse abdominis. So all these muscles are basically inserted on this linea alba through this special aponeurosis also. So whenever you are doing exercise of these abdominal wall muscles, so it means you are moving all these muscles, because they are interconnected through these a special connective tissue sheath, which is basically called as aponeurosis. And above this rectus abdominis, you have got a special deep layer of the fats, which is also enclosing your internal organs, and that is basically Kemper's fascia and then Scarpa fascia. So again, with the sequence, the first layer is basically skin. Behind the skin you have got the fascia, the Kemper's fascia, then you have got Scarpa fascia, and then you have got this external oblique muscle, then you have got internal oblique muscle, and then you have got transversalis fascia. After transversus abdominis muscle, you have got transversalis fascia, then you have got extraperitoneal fat, you have got peritoneum, and then you are approaching to the organs. So you have to draw all these layers of the anterior abdominal wall, and also you have to draw these structures. Posteriorly, on the posterior abdominal wall, you have got just few muscles. You have got iliacus muscle, you have got vas major and minor muscle, and then you have got quadratus laborum muscle. So in same sequence you have to draw the posterior abdominal wall also. Thank you for your concentration.